Care of patient with body elimination needs. Bladder and bowel function. Overview. The human body eliminates waste of metabolism through urine and stool. So, the normal function depends on these factors. First, anatomic integrity. Second, intact neurologic components for both voluntary and synergistic emptying. A predictable pattern of waste production, physical and mental ability, and the psychosocial willingness to carry out toilet, toileting related tasks. Structures and functions related to bowel elimination and digestion. First, we are going to deal with physiology of defecation. Peristaltic waves move the feces into the sigmoid colon and the rectum. Sensory nerves in the rectum are stimulated. After that, individual becomes aware of need to defecate. As the messages pass on, feces move into the anal canal when the internal and external sphincter relax. After that, external and anal sphincter is relaxed voluntarily if timing is appropriate. Expulsion of the feces take place as assisted by contraction of the abdominal muscles and the diaphragm. Move the feces through the anal canal and expel through the anus, facilitated by the flexion and a sitting position. Factors that affect bowel elimination are lifestyle. In lifestyle, there is personal habits. Personal habits includes exercise, and if you don't go when you need to go, and if you ignore the urge to defecate, that that can lead to bowel elimination problems. And if you don't stick to a bathroom routine, the longer stool stays in your intestine, harder it will become harder. Then cultural norms and Western culture, age. In age there is infancy and elders. These age person experience most of the digestive problems. Factors affecting bowel elimination. Physiological factors like pregnancy. In pregnancy, because of hormonal changes, constipation may occur or experienced by the patient. Motor and sensory disturbances. Patient with CNS disease or injury after have fecal incontinence and constipations. And intestinal pathology is not working properly, then patient may experience digestive problems. Medication and surgery and anesthesia can cause side effects to the patient and cause constipation. Psychosocial factors include anxiety and depression. Characters of normal stool are color, odor, consistency, frequency, amount, shape, and constituents. All you have to check for assessment. Then selected fecal elimination problems. There are some problems related to fecal elimination. These are constipation, diarrhea, bowel incontinence, flatulence. What, what is constipation? A symptom, not a disease. Decreased frequency of defecation, hard, dry, formed stool, straining at stools, painful defecation. And there are some causes included: insufficient fiber and fluid intake, as usual, insufficient activity, irregular habits, all can lead to fecal constipation. Then fecal impaction. What is fecal impaction? Mass or collection of hardened feces in folds of the rectum that cannot be expelled out. Passage of liquid fecal seepage and no normal stool. There are some causes related to fecal impaction that can lead to fecal impaction. Poor defecation habits, as I've told you, if you don't stick to a bathroom routine, or you don't go when you uh, need to defecate, or you urge to defecate, that can lead to fecal impaction. After unrelieved constipation, that is, it is result from unrelieved constipation, then treatment, we will treat it by removed it manually, must have physician order to doing these things, monitor patient for Valsalva reaction. Diarrhea, then passage of liquid feces and increased frequency of defecation. In this, spasmodic cramps, increased bowel sounds, fatigue, weakness, malaise, emaciation, all these things take place. A symptom of disorders affecting digestion, absorption, and secretion of the GI tract. There are some major causes for diarrhea: stress, medications, side effects, of course, allergies to some substance, intolerance of food. There are some kind of food everybody is not going to tolerate, and their stomach are sensitive to some kind of foods, so food allergies are also there. Fluids, disease of colon, fecal incontinence, loss of voluntary ability to control fecal, and gaseous discharges. It is generally associated with impaired functioning of anal sphincter or nerve supply. Neuromuscular disease, spinal trauma, tumor. All these things are affecting your nervous system. If your nervous system is damaged, the passage of messages is not appropriate and can lead to incontinence. Nursing consideration about it. Incontinence can harm a client body image. Incontinence predispose the skin breakdown. Body image, it affects body image, as if patient is experiencing incontinence, it can stool can pass at any time, at any place, so patient can experience low self-esteem at that time. And incontinence produce the skin breakdown also. If patient is passing stool continuously, it can cause harm to the skin also. Related nursing diagnosis: risk for deficit fluid volume, risk for impaired skin integrity, low self-esteem, disturbed body image, deficit knowledge, related to bowel training, ostomy management, anxiety. There are some desired outcomes: maintain or restore normal bowel elimination pattern, maintain or regain normal stool consistency, prevent associated risks such as fluid and electrolyte imbalance, skin breakdown, abdominal distension, and pain. So we should look over all these points. Then fecal elimination patterns. First of all, we have to look, keep some points in our mind. We have to provide privacy to the patient and ask the patient to stick to the timing. Nutrition and fluid. Ask patient to have fibrous food, or in case of constipation, and specific food for the specific condition, and take plenty of fluids. Then exercises promote health, positioning also prevent skin damage. There are some altered means of bowel elimination. If you are not able to pass out the stool or defecate, then some surgical procedures are done to facilitate the defecation. That is transverse colostomy, ascending colostomy, descending colostomy, ileostomy, schistosostomy, and sigmoidostomy. What is colostomy? It is a surgical procedure that brings one end of the large intestine out through the abdominal wall. During this procedure, one end of the colon is diverted through an incision in the abdominal wall to create stoma. A stoma, what is stoma? It is the opening in skin where pouch for collecting feces is attached. Ileostomy, it is surgical operation in which damaged part is removed from the ileum and cut and diverted to artificial opening. Now begin with the stoma care for the client with an ostomy. First of all, normal stoma should appear red and may bleed slightly when touched. You have to assess all these things when you are giving care to the patient with colostomy. Okay, assess the peristomal skin for irritation each time the appliance is changed. Treat any irritation or skin breakdown immediately. Keep skin clean by washing off any excretion and drying thoroughly. Then protect skin, collect stool, and control odor with an ostomy appliances. There are some common tests for direct visualization. Fiber optic endoscopy instrument introduced through the mouth or the rectum to inspect integrity of the mucosa and blood vessels and organs. There is UJ endoscopy and colonoscopy. Now urinary elimination. What is micturition? It is the process of emptying the bladder. Contraction of the detrusor muscle increase the pressure on the bladder to produce urge to urinate. Pressure overcomes the internal sphincter and urine enters the urethra. It requires relaxation of external sphincter, consciously relaxed or contracted. Then aids to normal urinary elimination. Daily fluid intake. Urine produced should be equal to the amount fluid is consumed. Okay. Then need 6 to 8 glass per day of water. Activity. External sphincter is part of pelvic muscle. Tone needed to maintain voluntary control. You have to promote Kegel exercises. Whenever patient go to urinate, you ask the patient to control urine, then pass and take deep breath. Okay. This activity should be done 2 to 3 times. It is called Kegel exercise to tone up the bladder muscle or pelvic floor muscle. Personal habits like relaxations and distractions. Structures and functions related to fluid elimination. First of all, deal with characteristics of normal urine. You have to check the color, clarity, and odor. As you have checked in the case of stool, you will check in the case of urine also. Clarity of the urine, color of the urine, odor of the urine. Altered amount. There are some alteration in urine amount. These alterations are oliguria. In oliguria, diminished scanty amount less than 30 cc is measured. And urea, this is absence of urine. Polyuria is more than 1500 cc per 24 hours. In this we consider intake also. Then and urasis. Common disruptions in urinary elimination are dysuria. In this there is difficulty in passing urine, painful urination and frequency. Hesitancy will be there, urgency will also be there. Common disruptions in urinary elimination, urinary retention. It is inability to pass part of the urine in bladder. It is mostly observed in older men with benign prostate hyperplasia. There in this, the size is enlarged of the prostate gland and cause retention of the bladder, retention of the urine in the bladder. Then urolithiasis. In this, stone scalpel block or partially block kidney ureters or bladder. These stones cause blockage in the urination process. It can be in kidney, it can be in ureters or bladders. Obstruction can also be caused by strictures, tumors, or edema if present. Forms of incontinence. Urinary incontinence. It is failure of major smooth muscle strength of distressor muscle of the bladder, instability or obstruction. Incontinence is divided into 4 parts or 4 types. These are urge incontinence, urgency following strong senses to void, decreased bladder capacity, alcohol or caffeine ingestion, and infection. These factors can lead to urgency if bladder capacity is decreased or bladder is not able to hold the urine, then it can lead to urgency, and alcohol or caffeine injection can also contributing factor in this. Then infection can also cause urgency. Stress incontinence. Small amounts with laughing, sneezing, coughing can lead to urgency or emergency. This happens mostly in pregnancies because the bladder is pressurized by the weight of the baby, and whenever the mother laughs, sneeze or cough, it causes stress incontinence. Overflow incontinence. It is in this retention take place. Functional incontinence. Intact urinary and nervous system. In this, change in environment, sensory, cognitive or mobility deficit, and patient void before reaching bathroom. In this, urinary and nervous system is perfectly normal, but change in environment or thinking process can lead to functional incontinence or void, patient void before going to bathroom due to urgency. Then loss of urinary control. In this, we are going to do assessment of urinary incontinence. Confirm factors related to episodes. You have to ask about how many episodes of patient had of urination. Then determine cognitive function and the ability of the patient to participate in interventions. Make observation during caregiving regarding the amount and frequency of loss of urine and situations surrounding incontinent episodes. Then assess the abdominal and suprapubic palpation for tenderness and fullness in case of urine retention. Determine hydration status and possibility of constipation. Ask specific questions regarding situations that lead to urine loss. As we have used altered means in elimination process, in bowel elimination, same here we will use some altered means to promote urination. These are catheters, urethral catheters, suprapubic catheters, condom catheters will be used, and some tests are conducted. Bilirubin, urea nitrogen test, creatinine clearance, urine analysis. These tests will be conducted. Then visualization procedure of kidney, urine, bladder, kidney, ureter, bladder. This is the reality. A plain abdominal X-ray and includes the structures such as diaphragm, above, and pelvis. Then retrograde pyelography and CT scan are to be conducted. So this was your elimination. Nursing management. Thank you so much for the class.